Janet Watson. I'm with the Community Technical Assistance Center, and I would like to welcome you to today's webinar, Employing Clinical Expertise to Address the Needs of LGBTQ+ Youth and Their Families. Before we get started, I want to take a moment to orient everyone so you'll know how to participate in today's event. Please note that upon joining the webinar, you have been placed on mute to avoid any background noises that may distract others from listening to the presentation. If you come across any technical issues during today's event, please chat to the host who will be able to assist you. You will have the opportunity to submit questions for the Q&A portions of today's presentation by utilizing the chat box feature. Click the dialog bubble on the toolbar at the bottom of your screen to open the chat features. In order to ensure that we are able to answer as many questions as time permits, we are requesting that you send in your questions at any point during the webinar, and we will address them during the Q&A portions of today's presentation. We are very excited to have with us today Dr. Brianna McGill, and she will introduce herself and tell us a little about herself. And again, thank you all so much. And then we will get started after she introduces herself. So thank you again.
Thanks so much, Janet. Like Janet said, I'm Dr. Brianna McGill. I'm an assistant professor in the School of Social Welfare at the University of Kansas, and primarily specialize in researching and offering cognitive behavioral clinical methods for supporting LGBTQ folks. So big picture, the goals for today are to help folks to identify strategies for tailoring mental health interventions for LGBTQ youth and their families. And really my hope here is today that folks can think through some of the clinical skills they've already developed and some of the reflections they've been having, and think about how those can be applied to meet the needs of LGBTQ youth and their families. I think a big part of it is that so often practitioners have developed these skills, but just don't necessarily see how they fit this sort of unique axes of identities and experiences. So to that end, we'll start by providing some definitions about LGBTQ identities to make sure that we're all on the same page moving forward. I'm going to provide some framing content, both that sort of frames how I put the content together today, but also framing for how I'd like folks to think about approaching their work with LGBTQ folks. And then we'll discuss some different options for approaching work with LGBTQ clients, again, trying to bridge some of the areas of expertise you all already have with some of the ways that we can meet the unique needs of LGBTQ clients. So a lot of definitions here, including sexual orientation, which is largely one's attraction to others and can fall on a spectrum and change over time. Lesbian, typically someone who identifies as a woman who's emotionally, physically, or sexually attracted to women. Gay person typically identifies as male, who's emotionally, physically, or sexually attracted to men. Bisexual, someone whose attraction is to folks of quote unquote either gender, but increasingly there's been a real effort to not have bisexual reinforce the gender binary, so the sense of bisexual being attracted to one's own gender and other genders. Pansexual, fairly similar, someone who is attracted to people of potentially all gender identities. And sexual minority, an umbrella term used by some to refer to the broad spectrum of non-heterosexual sexual orientations. And there were dozens of definitions I plausibly could have chosen here. And in some ways, my goal here is for folks to see that they're just a broad range of identities. And these identities look different for different folks. And so I encourage you to respect the identity labels that your clients use, even if they look different from how these definitions are presented. Adding a few more typically focused on gender here. So queer, I guess, is a broad umbrella term that refers to a big spectrum of non-heterosexual sexual orientations and non-cisgender gender identities. And this is a fairly fraught term in the community that, it was historically used as a slur and has been reclaimed by some members of the community and has a sort of radical connotation about resisting social norms. That said, queer is not a term that is resonant for everyone. And I think particularly my older clients often have some discomfort with the term. Then transitioning to some gender labels, cisgender, kind of thought of as not transgender. So someone whose gender identity aligns with their sex assigned at birth. Transgender is someone whose gender identity does not align with their sex assigned at birth. Gender minority can be an umbrella term used to refer to sort of a broad spectrum of non-cisgender gender identities. And then lastly, non-binary is a spectrum of gender identities that are not exclusively masculine or feminine, not exclusively male or female. And again, we really want to be respecting self-identifications here. And I just kind of wanted to highlight some of the basic terms and the variety of ways that folks might think of their attractions and genders. So now on to framing. And like I mentioned before, this is framing that was used to inform how this workshop was put together, but is also, I think, broadly speaking, framing that I think can be helpful in thinking through how we approach work with LGBTQ clients. First one is serving transgender clients. So as hopefully came through in our discussion of definitions, sexual orientation and gender identity are different things. Sexual orientation is more focused on attraction, whereas gender identity is more focused on one's own gender or a sense of, yes, as man, woman, non-binary, etc. And there are a lot of similarities in terms of why sexual and gender minority folks come to therapy. And some of those relate to sexual orientation and gender identity and some don't. I think things related to sexual orientation, gender identity that are common across, questions about disclosure, coping with discrimination. And while a lot of what we're talking about is relevant across the LGBTQ spectrum, I want to acknowledge that trans folks often have some distinct needs, particularly in terms of getting letters of support from mental health providers to access gender affirming care. And so I really encourage folks to get some additional training that's not covered today in terms of working with trans clients. Also, just acknowledging that we're coming at this as different experiences. I think sometimes these trainings are thought of as like, I, an LGBTQ presenter, come in and talk to a bunch of heterosexual and cisgender folks about LGBTQ issues. But I just want to acknowledge that folks are coming in with a lot of different levels of experience. And I'm really excited for the Q&A portion at the end to sort of discuss these issues. Also, you'll have my email address, so if you have additional questions, please feel free to reach out. Diversity. So I think in this like brief window of time we have together, it's kind of one broad stroke about working with the community, but I want to acknowledge that, there are sort of distinct differences across those different identity labels we were talking about. There are also distinct experiences within every label that like not every, say, lesbian experiences the world in the same way. And then when we add in the complexities of intersectionality, how sexual orientation and gender identity intersect with race, gender, socioeconomic status, ability, etc. It's a really complicated picture. And so I'm hoping to give you all tools, but as I'm sure you know in clinical work, things are often more complicated. I also want to acknowledge the role of structural factors. And I think clinical interventions, I've given my life to them, are a really powerful tool for helping folks navigate an oppressive world. But I also just want to put in that plug for more structural interventions that, yes, I am so happy to be able to help folks navigate this oppressive world, but I also encourage us all to think through what we can do to make the world less oppressive through more structural approaches as well. So the fundamental dilemma here is, on one hand, LGBTQ folks experience some distinct challenges, largely through navigating an oppressive world. That said, sexual orientation and gender identity are only a small aspect of who one is. And so folks come to therapy for a lot of other reasons: job loss, grief, breakups, etc. So often folks will be coming to therapy for reasons that have very little to do with their sexual orientation or gender identity. And in some cases, we'll be working with LGBTQ clients and we'll spend fairly little time talking about sexual orientation and gender identity. But I think it is really important to note that LGBTQ folks do experience challenges, again, largely in many cases owing to an oppressive world, increased risk for mental health problems, challenges in sort of understanding what their sexual orientations are, gender identities are. So really those questioning questions. Issues with discrimination at school, in the workplace, among their peers, with their parents, figuring out how to navigate the coming out process. And so again, I just want to be very explicit that in some cases you'll be working with LGBTQ youth who are just sort of navigating challenges that aren't so related to their sexual orientations or gender identities. But it's also really important to be able to be prepared to talk about some of those issues that are related to sexual orientation and gender identity. So to get a little bit of a pulse of where folks are coming at today, I'd love for folks to just type in the chat. We'll take maybe a minute or so to ask the question, what is the biggest concern you have when working with LGBTQ youth and their families? So please just sort of type in responses into the chat.
So Brianna, we're getting a few people chatting in, which is great. I'm wondering if maybe you can just call out some of these for maybe some folks that are not able to see the screen.
Yes, yep. So I'm loving the responses I'm getting. So a lot of concerns about unsupportive families. That one's huge. Issues related to bullying, trying to establish trust with clients and avoid unnecessary microaggressions. Dealing with cyberbullying. So yeah, these are absolutely fantastic. Using correct pronouns and names. Excellent. So these I think are really suggesting an awareness around some of the challenges LGBTQ youth face, as well as some of the ways that we, even as sort of well-meaning providers, can accidentally alienate our LGBTQ youth clients. Awesome. Thank you so much for the folks who responded. So now we're going to dive into a few of the different approaches that we have for serving LGBTQ youth and their families. And the first of these are protocol-based approaches, and these are thought of as manualized treatments. So we'll be discussing one called Affirm today. But often I think about the unified protocol or mind over mood as two other examples of clinical approaches where there's in session 1, we do this, in session 2, we do this, that can at times have the benefit of providing really clear guidance about how to frame a course of treatment. So again, these protocol-based approaches are manualized interventions that provide pretty explicit information about how to approach each session. And I also want to acknowledge that I have pretty thoroughly reviewed the research on Affirm, and I know the creators, but I'm not sort of involved with this initiative. But I did think it provided some really compelling information about how to think through working with LGBTQ youth and their families. So Affirm is an 8-module manualized cognitive behavioral treatment focused on coping and reducing depression. Really using those traditional CBT levers. So it really focuses on how thoughts and behaviors influence mood, with particularly identifying helpful coping strategies as sort of a behavioral lever for improving one's mood, particularly among LGBTQ youth who are depressed. So during Affirm, youth learn skills, but there's also some additional framing there. So providers acknowledge and validate some of the unique struggles experienced by sexual and gender minority youth. Really learn to explore how the youth up until now have coped with identity-specific stressors. So what are folks doing in response to these stressors? Those things you all mentioned, unsupportive families, bullying, and which of those stressors or which of those coping strategies are working well? And for the ones that maybe aren't working so well, what sort of other coping strategies might be more helpful? It also places a really big emphasis on enhancing the connection and support that youth get from peers and adult allies. So helping folks to, if they haven't already, find a supportive social network. So again, pretty classic CBT stuff. So each session consists of a warm-up and review from the previous week, discussion of session objectives, some sort of behavioral activity and practice and rehearsal. So usually there's some information, some psychoeducation, and then an opportunity to actually practice the skill, and then group reflection and summary. So some key elements of the psychoeducation involve discussing heterosexism, so like anti-LGBTQ bias and transphobia at the individual and cultural level. So helping LGBTQ youth, in case they don't already fully understand, see some of the distinct pressures they're experiencing. And then helping them distinguish, again, classic CBT stuff, between thoughts, feelings, and behaviors. And again, with CBT, typically we're trying to improve feelings by shifting thought patterns and behavioral patterns. And one of the strategies it uses on a cognitive level is challenging internalized homophobia through the ABCD method. And for folks who have practiced more cognitively, sometimes it's the ABC method, sometimes it's the ABCDE method, but really trying to apply those fairly traditional thought records tools to specific identity-based stressors. So I don't know, a hypothetical example might be activating event. Someone on my sports team said something pretty homophobic to me. And what kind of beliefs come up for me there? I'm never going to be able to fit in anywhere because I'm a bisexual youth. Consequences, obviously, that's thought is really painful. And then trying to evaluate maybe more balanced ways of thinking through that situation. And, you know, depending on the youth circumstances, that sort of dispute might look differently. So one sort of alternative thought they might come up with is, that person was absolutely a jerk to me and that's not okay. But most of the folks on the sports team were actually pretty nice to me. Or, yeah, this basketball team is just awful, but folks have been kinder to me on the volleyball team. So really trying to, in many cases, not diminish the like crappy stigmatizing things that happen, but to try to identify exceptions and more balanced ways of viewing it so folks can also see the places that maybe they are experiencing affirmation. Or I think another common issue is, you know, maybe the situation is really, really crappy right now. And in those moments, it can be really easy to imagine that situation is going to be really crappy forever. But for most cases, you know, folks are able to find more accepting environments. So really the goal here is pretty traditional cognitive interventions, helping folks to identify beliefs that are more accurate, balanced, and complete. Then we have behavioral approaches in a firm. And these really largely focus on helping youth to identify behaviors and activities that help them to feel better, including behaviors and activities that are affirming to their LGBTQ identities. And so a big factor here is figuring out what some of those activities are and coming up with plans to help folks engage more. And in some cases, it might be a very specifically LGBTQ activity, like joining a gay-straight alliance. In other cases, it might be joining that volleyball team that, you know, there's nothing specifically LGBTQ about the volleyball team, but it is an affirming space where someone feels good about themselves and how they're connecting with their peers. There's also an element of assertiveness training here. And I actually have not been able to see the specific assertiveness training they use in a firm. But I know a fairly common approach folks use in helping LGBTQ youth navigate discrimination harassment is something called DEAR. So DEAR, often used in DBT, often used in other cognitive behavioral approaches, involves describing what the concerning situation is, expressing how that concerning situation made them feel, asserting, making the clear and explicit ask about how they would like someone to behave differently, and then reinforcing it. So trying to bring that person in and make that request sort of palatable to them. So often these are used, again, trying to make a bridge between tools that maybe you've encountered and specifically LGBTQ content. A non-LGBTQ example of DEAR was this kiddo who wanted to borrow money for a concert. This kiddo said, "I'd like to borrow money for a concert this weekend." Express, "I think I've proven myself responsible in paying back money and can pay it back in a reasonable time." Assert, "Can I please borrow the money?" And reinforce, "I'd appreciate it and return the favor." Trying to sort of bridge that to an LGBTQ specific context. And I want to emphasize here that I encourage youth to only use this in a situation that seems like it is likely going to be safe. And not all situations where folks experience discrimination are safe to speak up. That said, I think particularly in contexts where maybe folks are unintentionally being hurtful, I think that's particularly a place where speaking up can, one, change the situation, and two, help folks feel empowered in their identities. And there is some research that suggests that engaging in identity-based advocacy can be really meaningful and beneficial for the mental health of marginalized youth. So in this case, an example, something like, "When you say that's so gay, you're really saying something's bad. So it feels like you're saying I'm bad. Please find another word and it'll make your LGBTQ friends much more comfortable around you." So then moving on to that last piece that sort of largely fits under the behavioral umbrella, but I think is also a bit distinct, social support. So Affirm really tries to highlight the importance of having healthy affirming support systems. And one part of that is this kind of cognitive element about helping youth to identify some of their thoughts, expectations, feelings, and behaviors within relationships. And I guess this is another place I want to highlight that it's fairly common for LGBTQ youth to distance themselves from their families and peers. And often that is rooted in a very, very reasonable place, that it was through rejection or discrimination that LGBTQ youth find themselves pulling back. That said, often there are still corners of the world where they can form meaningful and supportive connections. So trying to balance both the, oh my gosh, people in your life in the past and probably currently have at times treated you really poorly. And I'm wondering if there's a place where you do feel more supported. And I really want to help you find that because it's so important for mental health. So now transitioning from, that was the whirlwind tour overview of Affirm for Youth. One of the reasons I wanted to talk about Affirm today is there's also a companion intervention for working with caregivers. And based on that poll, this is clearly something that is pretty top of mind for folks, very understandably so. And so Affirm Caregiver is also a brief cognitive behavioral intervention focused on working with caregivers of LGBTQ youth. And it tries to help caregivers to learn more about what it means to be an affirmative caregiver to a young LGBTQ person. And I think, you know, often caregivers are really well-meaning, but just have a very poor sense of what would be affirming to their LGBTQ youth. And I think in many cases, we're working with caregivers and we see actions that can be really oppressive, but are perceived by the caregiver as being helpful. And so a place for learning. Also a place for reflecting, both on how current societal attitudes and beliefs, as well as their own attitudes and beliefs about LGBTQ youth impact the lives of the youth they're caring for. And then growth, so helping them to figure out how they can make changes to be a more affirmative provider for their LGBTQ youth. And something I really like about this intervention is I think it does hold space for some of the complexities of this process. So the goal is to, one, help the caregiver adopt an affirming stance towards LGBTQ youth, recognize some of the LGBTQ specific sources of stress that sometimes caregivers just don't know about issues like bullying and stigma and how they're impacting the kiddos that they're parenting or caregiving for. Acknowledge the critical role of caregiver support for youth with LGBTQ identities, and then help them to engage with their youth in a more affirming and trauma-informed way. So this is a place where I think they do a nice job of framing this issue. So LGBTQ children and youth need and deserve unconditional love and support. Caregivers may experience challenging emotions, and they need to find appropriate places to express and process their own feelings away from the child placed in their home, or potentially their own biological or adopted child. And so I think one element of this is providing more supportive spaces for caregivers to really air some of their concerns away from their LGBTQ youth. That it's critical to prevent harm, that caregivers must avoid rejecting behaviors. In order to help LGBTQ youth thrive, caregivers should actively support and affirm youth. And then this piece that I think is really important, that while caregivers often struggle to fully understand or reconcile an LGBTQ affirmative stance with their other values, it is absolutely critical to youth well-being that caregivers behave affirmatively with and towards their child, even while sorting out their own feelings. So a key emphasis here is we don't necessarily assume that attitudes and feelings are going to change overnight. And even while one is sort of working through some of that, there's still behaviorally ways that a caregiver can treat a child that are better for their mental health, and unfortunately ways that are worse. It's also compassion-focused intervention. So trying to focus on the suffering in oneself and others with a commitment to try to alleviate and prevent that. And some of the strategies that folks maybe have some experience with through other trainings, empathic listening, mindfulness approaches, compassion for others and compassion for self. And so just sort of planting the seed that for folks who do have more training in compassion focused interventions, this can be a really valuable place to apply some of that when working with caregivers. So some of the key activities involve understanding the sources of stress for LGBTQ youth and caregivers. Again, classic cognitive interventions. So having caregivers do some of those ABCD thought record kinds of approaches for challenging some of their homophobic attitudes. Or I think a place I've often found this approach helpful is evaluating kind of the pros and cons of behaving in particular ways. So even if I don't think that being LGBTQ is like morally okay, what are the benefits and drawbacks of a particular rejecting behavior? And I think sometimes folks see that like, they're still not into it, but behaving in a more accepting way is better for their youth, because behaving in a more rejecting way is unlikely to change the sexual orientation or gender identity, and is also just more likely to contribute to mental health problems among the youth. And then there are also behavioral approaches. So helping both their own youth to find access to affirming activities and places, but also the benefit of just kind of being immersed in supportive environments for caregivers, because I think there's some real modeling that can happen. And I also think that often caregivers can possess some fairly inaccurate beliefs around what an LGBTQ youth's life is going to look like. And so being in spaces with other LGBTQ youth and their families can sometimes provide some really helpful modeling and information, as well as just alleviate some anxieties about being a supportive caregiver. So Affirm is a proprietary intervention, and unfortunately being trained in it is fairly costly. That said, it does have really compelling research. So if you do happen to have either through your agency or whatever means, the like financial means to go through the training, you can find some more information at projectyouthAffirm.org. That said, I think even if one doesn't go through the training, that there are some fundamental principles that one can take from it based on the conversation that we've had about how to use some of the CBT tools that one already has to meet the needs of LGBTQ youth and their caregivers. So in other words, I think even without sort of the full training in Affirm, there are some key takeaways that one can have about approaching these issues. The other thing to sort of think about with manualized treatments generally is, like I mentioned before, on one hand, I think it's fantastic that they provide such clear and explicit guidance. And again, the research is compelling with them. Also, though, there aren't manualized interventions for every problem. And so sometimes we need more flexibility to address things like other life challenges, co-occurring disorders, et cetera. And so this is where we come into principles-based approaches. So principles-based approaches is really trying to think through what are the core principles of the interventions that I'm using, and how can they be applied to a particular challenge. And so we really saw a manualized version of this with using, say, a thought record to combat stigmatizing thinking patterns. But this can also be, employed outside of the context of a manualized intervention. So this is fairly old work at this point, but I think Martel, Safran, and Prince did a nice job of thinking through how some of the cognitive behavioral tools we have can be applied to LGBTQ folks. They primarily work with adults, but I did some adapting to think through how they might be applied to working with children. So really, this is just a couple of examples of ways that some of these tools could be applied. So one example, we have a 15-year-old lesbian female client who is struggling with depression following the breakup of her partner. And so in this case, the therapist used pretty cognitive tools to work with this client. So they identified some cognitive distortions. So one big one that came up here, and again, I want to really empathize with where this youth is coming from. She's like, oh goodness, there was one other lesbian in my high school. Now I'm never going to be able to find love again. And I think that suddenly becomes a much more believable perspective for youth who don't have big networks of other LGBTQ folks. But the goal really then came to be to develop more adaptive beliefs around dating. And the therapist used a thought record to help the client identify some of these thoughts and then evaluate them. And, I think for this particular client, the realization that, high school isn't forever. I'm probably going to, a bigger town for college, that like, yes, there's only one other lesbian in my high school, but that does not mean that that is the only lesbian that could be in my life forever. Another example is a gay teenage client who's living with depression, who's struggled to form interpersonal connections, largely avoiding socialization out of concerns about bullying. And so again, want to validate the kernel of truth and the like horrible reality that bullying is really awful and really detrimental to the lives of so many youth, including LGBTQ youth. And also holding that just because one has had these negative bullying experiences doesn't mean that there aren't places where the youth could be affirmed, and helping the youth in a very sensitive way to find some of those spaces. So the therapist really helped the client to understand that some of this pain from the bullying had really made it very tempting to avoid social interaction. And again, makes sense. And yet, unfortunately, I think this is a place where doing a cost-benefit analysis can be helpful. Of a benefit of avoiding social interaction is, sure, it can reduce the likelihood of some of these bullying experiences. Not in all cases, though. And we're also missing out on sort of all of the positive things that can come from community, the like joy that can be part of finding a shared activity with folks that you like, et cetera. And so in this case, the therapist used behavioral activation to help the client sort of figure out what all would be necessary to get involved with a gay-straight alliance. And again, I think it becomes breaking down into small pieces, not so much because it's logistically complicated, but because of some of the emotional complexities given this youth's sort of trauma with bullying. And so in this case, maybe just going to the meeting was a little bit intimidating at first, but like perhaps having a conversation with the president of the Gay Straight Alliance, or like the faculty advisor of the Gay Straight Alliance, doing those little things to build up to the bigger task of actually going to the GSA meeting. And then lastly, an example of, and again, I adapted this one a little bit, a pansexual non-binary client who was having some pretty significant academic anxiety that was contributing to school problems because they would avoid doing their schoolwork because it was just so anxiety provoking for them. And this is a case where, you know, there may have been some sexual orientation, gender identity related etiology to the onset of this problem, but overall, it was a fairly classic exposure intervention that, you know, they helped the client to, you know, immerse themselves in writing that paper for initially 10 minutes at a time and 20 minutes at a time until that anxiety died down. And I think part of why I included this example was just a reminder that sometimes issues related to sexual orientation and gender, or sometimes LGBTQ clients are primarily struggling with issues related to sexual orientation and gender identity, and sometimes they're not. So lastly is relationship-based approaches. And these are those cultural competence and cultural humility trainings that we find ourselves in. So trying to think through how do we use, broadly speaking, the therapeutic relationship to be supportive of our clients, and often, you know, the combination of how we leverage our relationship with our clients and employ the intervention approach of choice. So quickly, I'd like folks to take a moment to think through a time that a client surprised them. And if so, what assumptions did you maybe make that led to the surprise? How did your perspective change? And how might you generalize this lesson to your future work? So maybe just 30 or so seconds to think about that. I find these fairly straightforward prompts to be fairly helpful in my own work. An example that came up for me recently was I was working with a client who lived with schizophrenia and heard a lot of voices. And that's just not something that's part of my own lived experience. And I had made the assumption that the client, if he had his druthers, would not hear voices anymore. And then it became clear that the voices were really meaningful companions for him. And so he absolutely did not want to stop hearing voices. And in fact, his meds made it so he didn't hear as many voices. And that was one of the reasons that he wasn't taking them. And so I think that was really a learning experience for me, that based on sort of my own positionality, I had made some pretty false assumptions about what this client would want. And I think continuing to reflect on those moments can be really helpful for keeping an open mind, which is one of the key points that I'm going to try to make with this section of the presentation. So relationship-based approaches largely are comprised of cultural competence and cultural humility. And I think these are sort of Venn diagram concepts, but cultural competence can be defined as a therapist's unique knowledge base, set of attitudes and beliefs, and skill base for working with a particular population, such as LGBTQ youth. And so cultural competence, particularly that knowledge piece, has often focused on definitions of identities, like we saw at the very beginning of this presentation, highlighting the victimization and mental health disparities experienced by LGBTQ clients, understanding stages of identity development. I think increasingly these have fallen out of favor, which on one hand, the thing I like about these stages of identity development, things like first, so youth begins to question, and then they begin to understand what these identities are, then they internalize them, and then they form a meaningful relationship. There are all sorts of stages. Is on one hand, it's not so simple. Not all youth go through the same trajectory of identity formation, and there's not like one healthy path. And I think it can be helpful to understand that there are different processes involved in identity formation. And I think sometimes looking at those stages can provide us a sense of like some different moving parts that our youth are experiencing that maybe we wouldn't have thought of on our own. And then understanding microaggressions, often experienced by sexual and gender minority clients. And I think, this came up a little bit here, that there is some research on commonly reported microaggressions that LGBTQ clients in therapy face. And as you'll see when we talk about this list, I think a challenge here is that different clients have different desires and needs from their therapist. So something that one client will find microaggressive is unfortunately something that another client would find affirming. And so I think both being aware of some of these common pitfalls, but also sort of using those strategies that you've developed in terms of rupture repair with clients is also really important here. That yes, we want to try to avoid microaggressions, and sometimes they're unavoidable. And so the most important thing is listening to our client, taking that feedback seriously, and managing that dialogue in a respectful way. So some common microaggressions. One is the assumption that sexual orientation is the cause of all presenting issues. And then sort of the opposite side of that, avoiding and minimizing of sexual orientation. So, I think some therapists are really tempted to talk about it all of the time. Some therapists are uncomfortable, so don't try to talk about it at all. Clients also sort of fall in different places on that spectrum we talked about before, about how core it is to what's bringing them into therapy in the first place. So trying to calibrate that accordingly. Attempts to over-identify with LGBTQ clients. Again, this is clearly coming from a good place. But I think, clients reported things like their families were really rejecting of their sexual orientation, and therapists would say things like, I had a boyfriend that my parents didn't like once, and that can feel dismissive. Making stereotypical assumptions about LGBTQ clients, things like bisexual clients are promiscuous, that all lesbian relationships have like a butch femme dynamic, etc. Expressions of heteronormative bias. These can be sort of more overt things like indicating that heterosexuality is somehow superior. It can also be little things like, I had one job once, the intake form, they were gendered and sort of asked about female clients about husbands. So making sure that there isn't implicitly heteronormative bias in forms. I think increasingly we see this less with sexual orientation and more with gender identity. So, training for another day, but making sure the gender options on a form aren't just male, female, etc. Assumption that LGBTQ clients need psychotherapeutic treatment, just like all queer people need to be in therapy all the time. And then warning about the dangers of identifying as LGBTQ. And I think this is also sort of falling out of favor a little bit, but I do think that often therapists, again, in an attempt to sort of validate that there are additional challenges about being an LGBTQ person in our society, making it even more sort of gloom and doom than necessary, and creating sort of excessive and unnecessary concern above and beyond what the client's already experiencing. So cultural humility is more a process of openness, awareness. So being open to a range of different sexual identities and behaviors, self-awareness, understanding one's strengths, limitations, values, and beliefs. So I appreciated the folks who are trying to think through how they might be, inadvertently committing microaggressions. But I think that is an excellent place of being sort of self-aware about how am I currently connecting with clients and how can I improve that. Egolessness, so being humble and realizing that what is healthy for me, maybe what is healthy for other clients who quote unquote looks like me, in this case, hypothetically heterosexual, might not be what's healthy and best for everyone. And then self-reflection and critique. So this sort of ongoing process based on feedback. And often this occurs at an individual level, because again, I think clients have different needs and preferences. And so what is seen as really affirming with one client could be more marginalizing with a different one. And so self-reflection, I think taking that portion at the end of session where one asks for feedback really seriously, potentially having even sort of forms that folks can fill out can be really helpful for getting some more information through which to reflect and course correct. So I think really then the challenge here is we have this sort of knowledge element, like learning things about LGBTQ people and working with them. And we have this like openness. So what is the role of knowledge in trying to be an open and reflective provider? So I think sometimes knowledge about LGBTQ folks can produce stereotypes. So one thing I like to think of is I also find that having more knowledge, particularly in ways that there's like such diversity in the LGBTQ community. There are different paths to coming to terms with the effective identity label. There are different decisions one potentially needs to make around disclosing or not. So just sort of being aware of this like vast difference in experience can help us to identify places that we are maybe, like we saw in that reflection, making assumptions about our clients. It can also help us to consider things that could be going on for our clients that we hadn't considered. So opportunities for assessment. So, oh goodness, I know that, you know, homophobia in school and bullying and all of those things can happen for any of our clients, but, you know, aren't necessarily happening for all of our LGBTQ clients. So let's assess for that in the intake. It can also help us to avoid having our clients educate you about their cultural group. So we do still need to glean what the client's own perspective is, how they experience their identity, which of these unique sort of risk factors are going on for them, but does hopefully avoid us having to have our client explain, broadly speaking, let me tell you about gay people. And also sort of being aware of some of these potential microaggressions can help us avoid them in our own practice. So something I like is this framework for not making assumptions, and it's called the Describe, Interpret, Evaluate framework, and pulls from 3 levels of analysis. So the first is description, which is where we report something that we actually observed with our client, and try to spend more time in the description piece, like what is actually going on, before we get to interpretation, which is our own sort of perspective on what we observed and our own judgments about that. So staying at the descriptive level and then exploring more potential interpretations and sort of bringing our client in to those can be one way to reduce the impact that assumptions is having in our practice. So some example questions that can help us stay at the descriptive level for longer include things like, please tell me more about what it's like for you. Please tell me what's hard for you about, what's going on for you when, and oh goodness, you sound really concerned. Would you like to discuss blank? And an example of this is our client regularly, and we'll assume this is an LGBTQ client, regularly skips school. And there are a variety of potential reasons for that. And I think sometimes it can be easy to jump to, they just don't care about their education. But maybe the client doesn't see how school is relevant for them, particularly with other things going on in their lives. Or maybe the client has caregiving responsibilities at home and can't always get away to go to school. Maybe the client's experiencing bullying at school and worries for their safety. Maybe the client is prevented from using the bathroom or locker room that corresponds with their gender, and that's a really painful experience for them. So they prefer to not go to school because of how difficult these misgendering facilities are for their mental health. Or maybe the client has a chronic health condition that makes it hard to get to school. Potentially they don't have access to healthcare, and maybe there's a connection between the chronic health condition, their LGBTQ identity, or maybe not. But I think, sticking with a descriptive level and then considering a variety of different possibilities can then, one, reduce critical judgments we're making, but each of those problems has a different solution. And so I think both thinking through some of those ourselves, as well as sort of pulling from the client what might be going on, can help us to identify more effective solutions, all in response to the same fundamental behavior, which in this case is not going to school. So we just reached the end of the road for the different perspectives we're talking about. And I would love to take some time to answer some questions.
Thank you so much, Dr. McGee. Really appreciate it. I think you shared a lot of useful information that hopefully folks on the line can certainly go and think about, and at the very least think about and certainly implement in their work with the children and families that they're working with. Let's see. So we do have a couple of thank yous. I do want to start off. Let me just go to the Q&A here and see what has come through for folks. Give me a second. So we did have someone earlier on, and I think you might have addressed this. Just someone was wondering about where they can find someone who is trained in a firm. We did have two participants sort of chime in and say that, hey, this is happening, on my end locally, but I think you mentioned the web page for a firm. Is that somewhere that they could go, and maybe you can revisit that web page address?
Yes, absolutely. Yep. So for more information about getting trained, and again, I sort of want to acknowledge that it's a fairly expensive training, but is at projectyouthAffirm.org. So more information there. And then, there is some of the research publicly available about the intervention. So I think folks can sort of glean some of the tools and principles from the intervention. But if you want the full training, it's at projectyouthAffirm.org.
Great, thank you so much. And I know we are having, thank you, Connor, just put in that link in for Affirm. We are having the slides and the recording of this presentation available on our web page, which is ctacny.org, within 2 to 3 business days. So certainly revisit that as well. I also did want to put in ideally links. So we've actually worked with Brianna, for folks that are on the line now. We've worked with Dr. McGee, and she actually presented part 1 of a 2-part offering that we have. And I'm putting this in the chat thread here, because as you were all answering that question about what are some of those concerns, I did see things stand out, like how do I support the youth, but also work with the parents when there is sort of a conflict there, right? When they're maybe not accepting, when they are disowning the child. So if you have not had the chance, last year we did do a 2-part offering, really looking at MI and how do you use MI in that first offering with Dr. McGee to support the coming out process for LGBTQIA youth, right? How are they navigating? Who do I disclose to? When do I disclose to? Should I disclose? But part 2 was actually another set of presenters who were also applying MI as a way to work with caregivers of LGBTQIA youth. So we do have some resources, and I certainly invite you to visit those as well. I did just put in the link there. We had someone else say, appreciate the list of microaggressions in therapy. In an attempt to make everyone feel comfortable, I realized that I might be placing more weight on sexual orientation or gender identity than my client is. So any additional suggestions or information that you could maybe provide to folks so that we become a little bit aware of that, right? Because it's all that implicit bias that we may not be aware of. We're not even sure we're doing it, but again, certainly it was helpful for folks to sort of see that in black and white. Anything else that you might add for folks to help them guide or recognize that?
Yep. So I think permission seeking is a big part of this, because I think it's a challenge that, we may perceive sexual orientation to be more relevant than our client does. And in some cases, that is potentially a learning experience for the client. But in other cases, that's not a sort of helpful thing. So I think one way I've tried to frame it, a gender example comes to mind actually from my own experiences in therapy that I was discussing, feeling like I was speaking out but not being heard. And my therapist was like, a lot of my female clients express a similar concern. Do you think sexism might be part of what's going on there? And that gave me the opportunity to say yes or no. I think it also felt like it normalized it in the context of other folks who shared an identity. So I think that's one entree in to, be like, I do know other folks have had this experience. Do you think that's what's going on for you? If they're like, absolutely not, it's probably not a constructive road to go down. But if they're like, maybe, then I think that is sort of permission to explore that a little bit further.
Great, thank you. Another follow-up question that we have, how to help family members of LGBTQ plus clients adopt more supportive language without making them get defensive or feel attacked. So another way of bringing in caregivers and showing those ways where they can really support youth.
Yeah, and this is such a hard one. And I think sometimes comes down to like what the resistance is. So I think one thing, is mentioning, potentially somewhat heavy-handedly, some of the research about using names and pronouns being so well linked to mental health. And, there's some really compelling research findings that even having one adult who is trying really hard can make a big difference around suicidality risk. But I think also acknowledging that this can be challenging and hard. And again, I think it depends sort of what the challenge is, but like my sweet mother, I think is someone who's like really well-intentioned and wants to get those pronouns right, but like things like they, them pronouns are like new to her. And so, I think she struggles with them. So I think a lot of validating that like, this can be challenging. And that lots of the folks I'm working with have similar challenges, which is potentially true depending on who your client base is. I do think this is also a space where I like that a firm has those separate sessions for caregivers, some safe spaces to like air some of those concerns. Because I have found that sometimes just getting some space to say some of this stuff and not be judged can sort of bring down defensiveness even without much additional intervention. So those are just a few thoughts. I do think that MI training that Diana was mentioning is really, really good. And I think provides, a much more thorough overview of some extra things one can do.
Absolutely, thank you. And then let's see if we can squeeze in one or maybe two more questions. Around acceptance too, there was another question that came up around any particular suggestions to how to respond to caregivers or supportive, in quotes, systems who have concerns or are not accepting of LGBTQ youth primarily for religious reasons. Anything that you might add to that?
Yeah, and that's always such a tough one. I do find the cost-benefit analysis tool to be fairly helpful here. Like, I think there is a universe, I guess two things. So cost-benefit analysis tool, I think, can be helpful. That often folks end up seeing the conclusion that rejecting behaviors aren't going to get them the outcome that they want. That typically rejecting behaviors don't change the youth's sexual orientation or gender identity, and unfortunately often can pull folks further away. And in some cases can be a factor that like pulls an otherwise potentially religious LGBTQ person further from sort of faith than they otherwise would be. Another thing that like, I practice in a fairly secular way, and so don't always feel like everything can be done through these more secular lenses. I have found folks to, speaking of, as we had previously, finding more supportive spaces, finding, say, open and affirming congregations, and sort of seeing a space of this is a community of faith, but also a community that's accepting of LGBTQ folks. And I think sometimes folks are like, oh, wow, these folks do share more principles with me than I had expected. So even, I think it's honestly fairly rare that I've seen a radical transformation of like, oh, now I think it's okay to be gay in the eyes of God. But I think sometimes immersing oneself in more affirming religious communities have helped folks at least connect with their youth in more affirming ways, even if they are wrestling with some really difficult challenges around their religious views and their kiddos' sexual orientation or gender identity.
Great, thank you so much. So as we move forward, because I do want to be cognizant of time, towards the slides will be available within the next 2 to 3 days. But if we just move forward, I know that there's about 3 slides of references. So in case, as Dr. McGee was mentioning, some of the research or data, you can certainly access those once you download the slides. We do also have a slide on upcoming events. So please visit our website for a full list. These are some of the ones that are listed here. And on our final slide, I do want to thank you all. I want to thank Dr. McGee for a really informative presentation today. I want to thank everyone who has attended today's presentation. Again, 2 to 3 business days, you'll have the recording and the slides available for download at www.ctag.ny.org. You'll also be receiving a feedback survey link. There might have been some issues with the link, but nonetheless, it should pop up once this closes out. Please take the time to fill that out. A lot of our webinars are based on the feedback that we get from you all. What are your needs? How can we attend to them? So if you can take a moment to fill that out, that would be great. And again, on behalf of everyone here at CTAC and our presenters, thank you so much and have a good rest of your day. Thanks, everyone.